Okay, so there is something I want to cover before I talk about Gavin Newsom's accomplishments in California. So there was something that I was mistaken on. At first, I thought that he lowered the Medicare age in his state down to 50, but it turns out that that wasn't the case. So before I get into that, let me talk about Medicaid and Medi-Cal. So Medicaid, which was formed in 1965, Medicaid is a government program that provides health insurance for adults and children with limited income and resources. The program is partially funded and primarily managed by state governments, which also have wide latitude in determining eligibility and benefits. But the federal government sets baseline standards for state Medicaid programs and provides a significant portion of their funding. Medicaid was established in 1965, part of the Great Society set of programs during the Lyndon Johnson administration, and was significantly expanded by the Affordable Care Act, which was passed by Obama in 2010. In most states, any member of a household with income up to 138% of the federal poverty line qualifies for Medicaid coverage under the provisions of the ACA. A 2012 Supreme Court decision established that states may continue to use pre ACA Medicaid eligibility standards and receive previously established levels of federal Medicaid funding. In states that make that choice, income limits may be significantly lower, and able bodied adults may not be eligible for Medicaid at all. Now, let me get to right here on ChatGPT and how they broke it down, because in terms of the federal state thing, just so we all understand it, is Medicaid federal or state? Medicaid is a joint federal federal and state program. It is funded and administered by both the federal government and individual states, but each state has a significant degree of flexibility in how it operates its Medicaid program. Here's a breakdown. Federal level. The federal government establishes broad guidelines and provides funding to states. The amount of federal funding varies based on each state's income levels and needs. State level. Each state administers its own Medicaid program, including setting eligibility criteria, determining the benefits offered, and managing enrollment and claims processing. States can also apply for waivers to customize their programs to address specific needs. This partnership allows Medicaid to adapt to the unique circumstances of each state while maintaining a baseline of federal requirements to ensure coverage for low income individuals, families, and other eligible populations. Now, what is Medi Cal? What are the key points of it? What are the benefits of it? When was it implemented? Was it through state legislation or via executive order? Medi-Cal is California's Medicaid program. Now, see, that's where I was mistaken. At first, I thought it was, again, but this is the importance of reading and researching and, getting the facts together. At first, I thought it was Medicare. I was mistaken. I had put that out there before. Not going to make that mistake again. So that's me correcting my mistake right there. Medi-Cal is California's Medicaid program providing free or low-cost health coverage to eligible residents, including individuals with low income, families, seniors, persons with disabilities, pregnant women, and children. Medi-Cal is funded by both the state of California and the federal government. Now, here are the key points. Eligibility, based on income, family size, and household situation. Income thresholds are determined relative to the federal poverty level. Some groups automatically qualify, like SSI recipients, supplemental security income. Two, services covered: doctor visits, hospital stays, and emergency services, preventative care like vaccinations and screenings, prescription drugs, mental health services, and substance use treatment, dental and vision services for children and many adults, long term care for seniors and disabled individuals. Cost: free for most eligible individuals. Some programs within Medi-Cal require small co-payments or premiums depending on the individual's income and circumstances. Administration, overseen by California's Department of Healthcare Services. Services are provided through managed care plans or on a fee-for-service basis. Expansion, under the Affordable Care Act, Medi-Cal expanded in 2014 to include more low-income adults without dependent children. Implementation, the year of inception. Medi-Cal was established in 1966 as part of the implementation of the federal Medicaid program under the Social Security Amendments of 1965. Legislation versus executive order. Medi-Cal was implemented through state legislation, aligning California with the federal Medicaid program. The law enabling Medi-Cal was passed by the California State Legislature and signed by the governor. Now, who was the governor at the time? Medi-Cal was established in 1966 under the leadership of Governor Pat Brown. He served as the governor from 1958 to 1966 and played a significant role in expanding social programs, including health care, during his tenure. Medi-Cal aligned California with the federal. Okay, we've already covered that. Now let me go to benefits. Now there's four major benefits of it. The first one is health access for vulnerable populations. It provides vital health services to low-income individuals who might otherwise be unable to afford care. Two, improved public health outcomes. Ensures broader access to preventative services and treatment, reducing long-term healthcare costs. Three, economic support. It reduces the financial burden of medical expenses for individuals and families. Four, comprehensive care. Covers a wide range of medical needs, ensuring individuals can receive both acute and long-term care. Okay, so hope you understand that. Now that I got that out the way, the next video is going to cover Gavin Newsom's accomplishments as not only governor, but the positions that he had before governor, which is he was a city councilman of San Francisco, later became the mayor of the city, and before he was governor, he was lieutenant governor, aka vice governor. So I'm going to get into all that in a bit, but like, subscribe, comment. All my socials are in my about section, whether you're watching this on Facebook or YouTube or wherever you're watching it at. So I just wanted to throw that out there, inform you about that, and I got more coming. Stay tuned.